Question 1. Investigation of an unexpected fire alarm sounding in a multi-species animal boarding facility, with visible smoke starting to fill a section of the building. Staff are present and aware of the alarm. What is the most appropriate immediate course of action for the animal care staff? Option A. Calmly and systematically begin securing animals in appropriate carriers or enclosures for transport to the designated safe zone, prioritizing those in immediate danger or with specific needs. Option B. Open all animal enclosures to allow them to escape and find their own safety. Option C. Attempt to gather all personal belongings and essential facility equipment before initiating any animal evacuation. Option D. Focus on containing the fire by attempting to extinguish it with available equipment before addressing animal evacuation. The correct answer is A. Calmly and systematically begin securing animals in appropriate carriers or enclosures for transport to the designated safe zone, prioritizing those in immediate danger or with specific needs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, decisive action under stressful conditions where the safety of animals and potentially humans is at risk. The presence of different animal species with varying needs and temperaments, coupled with potential hazards like smoke and structural instability, complicates the evacuation process. Effective judgment is required to prioritize actions, allocate resources, and ensure the well-being of all involved while adhering to established protocols. Correct approach analysis. The correct approach prioritizes the immediate safety of the most vulnerable animals and ensures a systematic, organized evacuation. This aligns with the principles of animal welfare and emergency preparedness mandated by Australian animal care regulations, such as those underpinning the Certificate Roman IV in Animal Care, ACM4. Specifically, it reflects the duty of care to prevent suffering and injury, which is paramount during emergencies. A calm, methodical approach, involving securing animals in appropriate carriers and moving them to a designated safe zone, demonstrates adherence to best practice in animal handling and emergency response. This approach minimizes stress and risk of escape or injury to the animals. Incorrect approaches analysis. One incorrect approach involves attempting to evacuate all animals simultaneously without proper containment. This is a significant regulatory and ethical failure as it increases the risk of animal injury, escape, and potential harm to staff. It demonstrates a lack of understanding of safe animal handling during emergencies and a disregard for the duty of care to prevent distress and harm. Another incorrect approach is to prioritize personal safety over the immediate evacuation of animals, leaving them unattended in a hazardous environment. This constitutes a severe breach of the duty of care owed to the animals under Australian animal welfare legislation. It also fails to meet the professional standards expected of individuals working in animal care, where the welfare of the animals under their charge is a primary responsibility. A third incorrect approach is to focus on non-essential tasks, such as gathering personal belongings or attempting to secure non-critical equipment before initiating animal evacuation. This is a failure of professional judgment and prioritization in an emergency. It deviates from the core responsibility of ensuring the safety and well-being of the animals, potentially leading to their injury or death due to delayed evacuation. Professional reasoning. Professionals in animal care must develop a clear decision-making framework for emergencies. This framework should include 1. Immediate threat assessment. Identify the nature and severity of the emergency. 2. Prioritization of life and safety. Focus on the immediate well-being of animals and humans. 3. Protocol activation. Recall and implement established emergency evacuation procedures. 4. Resource allocation. Determine necessary equipment and personnel. 5. Systematic execution. Implement the evacuation in a calm, organized manner, prioritizing the most vulnerable. 6. Communication. Maintain clear communication with team members and relevant authorities. This structured approach ensures that actions are efficient, effective, and ethically sound, minimizing harm and maximizing the chances of a successful outcome. Question 2. Benchmark analysis indicates that a client presents their 8-year-old dog, reporting increased lethargy and a dull, poor-quality coat over the past month. The client mentions the dog has been on the same commercial dry food diet for 3 years and has no other known health issues. What is the most appropriate initial approach to address the dog's presenting signs? Option A. Advise the client that these symptoms are typical for a dog of this age and suggest they simply increase the dog's daily exercise to combat the lethargy. Option B. Conduct a thorough physical examination, gather a detailed dietary history, and consider diagnostic tests to identify the underlying cause of the lethargy and poor coat condition before recommending any specific nutritional interventions. Option C. Immediately recommend a change to a high-quality, grain-free kibble, as these diets are often beneficial for coat health and can improve energy levels in older dogs. Option D. Prescribe a broad-spectrum omega-3 fatty acid supplement and a multivitamin, as these are generally safe and can improve coat quality and overall vitality. The correct answer is B. Conduct a thorough physical examination, gather a detailed dietary history, and consider diagnostic tests to identify the underlying cause of the lethargy and poor coat condition before recommending any specific nutritional interventions. Explanation. Scenario analysis. This scenario presents a common challenge in animal care where a perceived health issue requires a nuanced approach to diagnosis and treatment, balancing immediate intervention with thorough investigation. The professional must navigate potential risks to the animal's welfare, client expectations, and the responsible use of resources, all within the regulatory framework governing animal health and nutrition in Australia. The challenge lies in identifying the most appropriate and compliant course of action when faced with incomplete information and potential underlying causes. Correct approach analysis. The correct approach prioritizes a systematic and evidence-based risk assessment. This aligns with the principles of responsible animal care and the requirements under Australian animal welfare legislation, which mandate that animals be provided with appropriate nutrition and veterinary care. A thorough assessment, including a physical examination and dietary history, is crucial for identifying the root cause of the animal's lethargy and poor coat condition. This approach minimizes the risk of misdiagnosis and inappropriate treatment, ensuring the animal receives the most effective care while adhering to professional standards and ethical obligations. It also respects the client's role in providing accurate history and their right to informed decision-making regarding their pet's health. Incorrect approaches analysis. One incorrect approach involves immediately recommending a diet change without a comprehensive assessment. This is a failure to conduct a proper risk assessment. It could lead to an inappropriate diet being prescribed, potentially exacerbating existing health issues or introducing new ones, and failing to address the actual cause of the lethargy and poor coat. This bypasses the professional obligation to diagnose before treating and could contravene guidelines on responsible veterinary advice. Another incorrect approach is to dismiss the client's concerns and suggest the animal is simply aging. This demonstrates a lack of professional diligence and a failure to adequately assess the animal's health status. Aging animals can still experience treatable conditions, and ignoring potential health problems can lead to delayed diagnosis and treatment, negatively impacting welfare and potentially violating animal welfare standards that require prompt attention to signs of distress or illness. A third incorrect approach is to suggest a highly specific, expensive supplement without a confirmed diagnosis. This is financially irresponsible and potentially harmful. Without understanding the underlying cause, the supplement may be ineffective or even detrimental. This approach fails to adhere to the principle of evidence-based practice and could be seen as a breach of professional conduct by recommending treatments without proper justification, potentially misleading the client about the necessity and efficacy of the intervention. Professional reasoning. Professionals should approach such situations by first gathering all available information, including the client's observations and the animal's history. This is followed by a systematic physical examination. Based on these findings, a differential diagnosis should be formulated, and appropriate diagnostic tests or further investigations should be recommended. The client should be involved in the decision-making process, with clear explanations of the findings, potential causes, and recommended treatment plans, including associated risks and benefits. This structured approach ensures that care is evidence-based, ethically sound, and compliant with Australian animal care regulations. Question 3. Compliance review shows that a shelter has recently received a group of 6 adult domestic cats from a hoarding situation. These cats have had minimal socialization with humans and each other. They are currently housed in separate enclosures, but the shelter is considering moving them into a larger communal space to encourage socialization and reduce stress. What is the most appropriate course of action to ensure the welfare of these cats, considering their background and the principles of social structure in domestic animals? Option A. Keep the cats in separate enclosures indefinitely to prevent any potential conflict and ensure individual safety, as their past experiences may make them inherently incompatible. Option B. Immediately place all 6 cats into a large, enriched communal space to allow them to establish their own social hierarchy and learn to interact naturally. Option C. Introduce one new cat at a time into the communal space with one of the existing cats, observing their interactions before adding further individuals. Option D. Gradually introduce the cats to a shared space, starting with supervised, short periods, and closely monitoring their interactions for signs of stress or aggression, before increasing the duration and complexity of their cohabitation. The correct answer is D. Gradually introduce the cats to a shared space, starting with supervised, short periods, and closely monitoring their interactions for signs of stress or aggression, before increasing the duration and complexity of their cohabitation. Explanation. This scenario is professionally challenging because it requires the animal care professional to balance the immediate needs of individual animals with the long-term health and well-being of a group, all while adhering to Australian animal welfare standards and the principles of responsible animal husbandry. Understanding the social structures of domestic animals is crucial for preventing stress, aggression, and disease transmission, which directly impacts their welfare. The correct approach represents best professional practice because it prioritizes a thorough assessment of the existing social dynamics before implementing any changes. This aligns with the principles of the Prevention of Cruelty to Animals Act 1979, NSW, and similar legislation across Australia, which mandate that animals must be provided with adequate accommodation, management, and care to ensure their welfare. By observing and understanding the established hierarchies, individual temperaments, and potential stressors within the group, the professional can make informed decisions that minimize disruption and promote a harmonious environment. This proactive, evidence-based approach is ethically sound and legally defensible, as it demonstrates due diligence in animal care. An incorrect approach that involves immediately separating all animals without prior assessment fails to acknowledge the potential benefits of stable social groups and could induce unnecessary stress and anxiety in animals accustomed to their established social order. This could be seen as a failure to provide adequate care and management, potentially contravening animal welfare legislation by causing undue distress. Another incorrect approach, such as introducing new animals without considering existing social dynamics, risks immediate conflict, aggression, and potential injury, which is a direct failure to manage the animals appropriately and ensure their safety and well-being. A third incorrect approach, focusing solely on the physical health of the animals and neglecting their social needs, overlooks a critical component of holistic animal welfare, which is increasingly recognized in Australian animal welfare guidelines and legislation. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the animal's current environment and social interactions. This involves observation, understanding species-specific social behaviors, and identifying any signs of stress or conflict. Based on this assessment, a plan should be developed that prioritizes the least invasive and most beneficial interventions for the animal's welfare. This plan should be regularly reviewed and adjusted as needed, always with the goal of promoting a healthy and stable social environment. Question 4. The control framework reveals that an animal care facility operating in Australia must adhere to a hierarchy of regulatory instruments to ensure the welfare of animals in its charge. Which of the following approaches best reflects the primary regulatory obligation for such a facility? Option A. Prioritizing adherence to the specific state or territory Animal Welfare Act and its associated regulations. Option B. Ensuring client satisfaction is the paramount consideration, even if it requires deviating from some internal policies. Option C. Focusing exclusively on industry best practice guidelines published by peak animal care bodies. Option D. Relying solely on the facility's internal operational policies and procedures manual. The correct answer is A. Prioritizing adherence to the specific state or territory Animal Welfare Act and its associated regulations. Explanation. This scenario is professionally challenging because it requires an individual working within the Australian animal care industry, specifically in a role aligned with the Certificate Roman IV in animal care, ACM4, to understand and apply the overarching regulatory framework governing animal welfare and business operations. The challenge lies in identifying the most appropriate regulatory instrument that dictates the standards for animal care facilities and services, ensuring compliance and ethical practice. Careful judgment is required to distinguish between general industry principles and specific legislative mandates. The correct approach represents best professional practice because it directly addresses the legislative requirements for operating an animal care facility in Australia. Adherence to the relevant state or territory Animal Welfare Act and associated regulations is a legal obligation. These acts provide the minimum standards for the care, accommodation, and treatment of animals, and compliance is essential for maintaining a license to operate, preventing animal cruelty charges, and upholding public trust. This approach demonstrates a commitment to legally mandated welfare standards, which is the foundation of responsible animal care. An incorrect approach that focuses solely on industry best practice guidelines without referencing the underlying legislation is professionally unacceptable. While industry guidelines are valuable for exceeding minimum standards and promoting excellence, they are not legally binding in the same way as legislation. Relying only on these could lead to non-compliance with legal requirements, potentially resulting in penalties, facility closure, or animal welfare breaches. Another incorrect approach that prioritizes client satisfaction above all else, even if it means potentially compromising animal welfare standards, is ethically and legally flawed. The primary responsibility of an animal care professional is the welfare of the animals in their care. Client satisfaction is important, but it must be achieved within the bounds of legal and ethical obligations to the animals. Failing to uphold these obligations constitutes a breach of professional duty. A further incorrect approach that suggests focusing only on the business's internal policies and procedures is also professionally unacceptable. Internal policies are crucial for consistent operations, but they must be developed in alignment with and to meet or exceed the requirements of relevant legislation. An internal policy that falls short of legal standards offers no protection and is ultimately non-compliant. The professional decision-making process for similar situations should involve a hierarchical approach to regulatory understanding. First, identify and understand the primary legislative framework, e.g., state/territory animal welfare acts. Second, consult relevant subordinate legislation and codes of practice issued under these acts. Third, review industry-specific guidelines and best practice document to identify opportunities for exceeding minimum standards. Finally, ensure all internal policies and procedures are consistent with and support compliance with the legislative and regulatory requirements. This systematic approach ensures that legal obligations are met, ethical standards are upheld, and the highest possible level of animal welfare is provided. Question 5. The analysis reveals that a rescue shelter is experiencing an increase in admissions of underweight domestic cats. A new staff member, eager to implement efficient feeding practices, suggests a single, highly palatable commercial dry food formulation for all incoming cats, citing its widespread availability and perceived ease of use. However, the shelter veterinarian has noted that some cats are exhibiting signs of digestive upset and poor coat condition despite consuming this food. Considering the principles of animal care and relevant Australian regulatory frameworks, what is the most appropriate approach to optimize feeding practices for these underweight cats? Option A. Introduce a new, more expensive commercial dry food that is marketed as a weight gain formula without further assessment, believing that a different brand will resolve the problem. Option B. Rely on the experience of long-term staff members to determine appropriate feeding amounts and types of food based on their observations of what has worked in the past for similar cases. Option C. Develop individualized feeding plans for each cat based on a veterinary assessment of their specific nutritional needs, considering their health status, age, and any underlying medical conditions, and select appropriate high-quality, species-appropriate diets, which may include a combination of wet and dry foods. Option D. Increase the quantity of the current commercial dry food offered to all cats, assuming that the issue is simply insufficient caloric intake and that the food itself is adequate. The correct answer is C. Develop individualized feeding plans for each cat based on a veterinary assessment of their specific nutritional needs, considering their health status, age, and any underlying medical conditions, and select appropriate high-quality, species-appropriate diets, which may include a combination of wet and dry foods. Explanation: this scenario presents a common challenge in animal care, balancing the immediate needs of an animal with the long-term health implications of dietary choices, all within a regulated framework. The professional challenge lies in interpreting and applying the principles of animal nutrition and relevant Australian legislation to a specific case, ensuring both welfare and compliance. Careful judgment is required to move beyond anecdotal evidence or convenience to evidence-based, legally sound feeding practices. The correct approach represents best professional practice because it prioritizes a holistic assessment of the animal's nutritional requirements based on scientific principles and current best practices in animal husbandry, as guided by the principles of the Certificate Roman IV in Animal Care, ACM4, curriculum, and relevant Australian animal welfare legislation. This involves considering species-specific needs, life stage, health status, and environmental factors, formulating a diet that is balanced, palatable, and meets these requirements directly contributes to the animal's physical and psychological well-being, which is a core ethical and legal obligation. Adhering to these principles ensures that feeding practices are not only effective, but also responsible and compliant with the standards expected of a qualified animal care professional. An incorrect approach that relies solely on readily available commercial pet food without considering the specific needs of the animal fails to meet the professional standard. This could lead to nutritional deficiencies or excesses, impacting the animal's health and potentially violating the duty of care under Australian animal welfare laws, which mandate providing adequate nutrition. Another incorrect approach that focuses only on cost-effectiveness without a thorough nutritional assessment overlooks the primary responsibility of ensuring the animal's health and well-being. This prioritizes economic factors over welfare, which is ethically and legally unacceptable. An approach that uses anecdotal evidence or personal preference for feeding methods, without scientific backing or consideration of the animal's individual needs, demonstrates a lack of professional rigor and a failure to adhere to evidence-based practices, potentially leading to suboptimal health outcomes and contravening the expected standards of care. Professionals should employ a decision-making framework that begins with a thorough assessment of the animal's individual needs, including species, breed, age, health status, activity level, and any specific dietary requirements or sensitivities. This assessment should then be cross-referenced with current scientific literature and best practice guidelines for animal nutrition. The next step involves consulting relevant Australian legislation and codes of practice pertaining to animal welfare and nutrition. Finally, the professional should formulate a feeding plan that is balanced, appropriate, and cost-effective, while always prioritizing the animal's health and well-being. Regular monitoring and adjustment of the diet based on the animal's response are crucial components of this ongoing professional responsibility. Question 6. The risk matrix shows a moderate risk rating for a stray dog exhibiting signs of anxiety and potential aggression in a public park. What is the most appropriate initial course of action for an animal care professional responding to this situation? Option A. Advise parkgoers to avoid the area and wait for the dog to calm down on its own before attempting any intervention. Option B. Recommend immediate euthanasia of the dog due to the potential for aggression, as indicated by the risk matrix. Option C. Immediately attempt to capture the dog using a net, regardless of its behavior, to prevent any potential incidents. Option D. Approach the dog cautiously, attempt to assess its temperament from a safe distance, and contact local animal control services to arrange for safe capture and assessment. The correct answer is D. Approach the dog cautiously, attempt to assess its temperament from a safe distance, and contact local animal control services to arrange for safe capture and assessment. Explanation: this scenario is professionally challenging because it requires the animal care professional to interpret a risk matrix and apply it to a practical situation involving animal welfare and public safety, which are core responsibilities within the Australian animal care sector, governed by relevant state and territory legislation and industry codes of practice. The professional must make a judgment call that balances the immediate needs of the animal with the potential risks to the public and other animals, all within the framework of responsible animal management. The correct approach represents best professional practice because it prioritizes a systematic and documented process for risk assessment and mitigation. This aligns with the principles of duty of care and responsible pet ownership mandated by Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in various states, and industry guidelines that emphasize proactive risk management. By identifying the hazard, assessing the likelihood and consequence of harm, and then implementing appropriate control measures, the professional demonstrates a commitment to preventing harm and ensuring the safety and well-being of all involved. This methodical approach also provides a defensible record should any incident occur. An incorrect approach that focuses solely on the immediate comfort of the animal without considering the potential for escape or aggression fails to meet the legal and ethical obligations to prevent harm to the public and other animals. This could contravene sections of animal welfare legislation that address public safety and the prevention of nuisance. Another incorrect approach that involves immediate euthanasia without exploring less drastic mitigation strategies would be ethically questionable and potentially a breach of duty of care, as it bypasses the obligation to seek the least harmful solution and could be seen as an overreaction without proper assessment. A third incorrect approach that involves ignoring the identified risks due to perceived inconvenience would be a direct failure of professional responsibility and could lead to significant legal and ethical repercussions, including potential prosecution under animal cruelty or public safety laws. Professionals should use a decision-making framework that begins with thorough hazard identification, followed by a systematic risk assessment using tools like a risk matrix. This assessment should inform the selection and implementation of control measures, with a plan for ongoing monitoring and review. The process should always consider the specific context, the species of animal, its behavior, the environment, and the potential impact on all stakeholders, including the public, other animals, and the animal itself. This ensures that decisions are evidence-based, proportionate, and aligned with regulatory requirements and ethical standards. Question 7. Research into animal communication and body language suggests that a new rescue dog is exhibiting signs of anxiety. Which approach best reflects the professional responsibilities and ethical considerations for a Certificate Roman IV in animal care professional in Australia when assessing this dog's behavior? Option A. Immediately attempt to comfort the dog with petting and vocal reassurances, assuming that any observed behavior is a direct request for attention. Option B. Prioritize consulting reputable veterinary behavior resources and observing the dog's full range of body language cues in its environment before making any handling decisions. Option C. Rely on personal past experiences with similar-looking dogs, as this experience is likely sufficient to understand the current dog's needs. Option D. Focus solely on the most obvious behaviors, such as tail tucking, and interpret them in isolation without considering other contextual cues. The correct answer is B. Prioritize consulting reputable veterinary behavior resources and observing the dog's full range of body language cues in its environment before making any handling decisions. Explanation: this scenario is professionally challenging because accurately interpreting animal communication and body language is crucial for ensuring animal welfare, safety, and effective care. Misinterpreting these signals can lead to stress, injury, or even harm to both the animal and the handler. The Certificate Roman IV in Animal Care (ACM4) curriculum emphasizes the importance of understanding these nonverbal cues as a fundamental aspect of responsible animal handling and care, aligning with the Australian animal welfare standards and guidelines. The correct approach represents best professional practice because it demonstrates a commitment to evidence-based understanding and a proactive, observational method. By consulting multiple, reputable sources and observing the animal's behavior in context, a professional can build a comprehensive understanding of the animal's emotional state and needs. This aligns with the ethical obligations under Australian animal welfare legislation to provide appropriate care and prevent suffering, which necessitates accurate assessment of an animal's well-being. An incorrect approach that relies solely on anecdotal evidence or personal assumptions fails to meet professional standards. Anecdotal evidence is not scientifically validated and can perpetuate myths or misunderstandings about animal behavior. Relying on personal assumptions without objective observation and research can lead to misjudgments that negatively impact the animal's welfare. This could be seen as a failure to exercise due diligence in providing appropriate care, potentially contravening the duty of care expected of a Certificate Roman IV qualified animal care professional. Another incorrect approach that prioritizes immediate intervention without thorough observation is also professionally unacceptable. While prompt action is sometimes necessary, Acting without understanding the underlying cause of the behavior, as indicated by body language, can exacerbate the situation or lead to inappropriate handling. This demonstrates a lack of critical thinking and observational skill, which are core competencies for ACM4 graduates. It could also lead to actions that cause unnecessary stress or fear to the animal, violating principles of humane treatment. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe the animal's behavior and body language in its current environment. 2. Consider the context of the behavior. 3. Consult reliable evidence-based resources, e.g., veterinary behavior texts, peer-reviewed articles, established animal behaviorist guidelines. 4. Formulate a hypothesis about the animal's emotional state or needs. 5. Test the hypothesis through further observation or gentle, appropriate interaction. 6. Adapt care and handling strategies based on the evolving understanding of the animal's communication. This iterative process ensures that decisions are informed, ethical, and prioritize the animal's welfare. Question 8. Examination of the data shows a junior animal care attendant observing a dog in their care exhibiting subtle signs of lethargy and a reduced appetite. The attendant has basic knowledge of common canine ailments but is not a veterinarian. The attendant is concerned but unsure if the observation warrants immediate escalation. What is the most appropriate course of action for the junior attendant to take? Option A. Attempt to research the symptoms online and administer a mild over-the-counter remedy they believe might help. Option B. Immediately report the observed changes in the dog's behavior and appetite to their direct supervisor or the designated veterinarian on duty. Option C. Decide that the symptoms are minor and likely to resolve on their own and continue to monitor the dog without reporting it. Option D. Discuss their concerns with other junior attendants to gauge their opinions before deciding on a course of action. The correct answer is B. Immediately report the observed changes in the dog's behavior and appetite to their direct supervisor or the designated veterinarian on duty. Explanation. This scenario presents a common challenge in animal care settings where a junior staff member, while well-intentioned, may not fully grasp the scope of their responsibilities or the importance of adhering to established protocols. The professional challenge lies in ensuring that all staff understand and execute their roles effectively to maintain the highest standards of animal welfare, which is a core ethical and legal obligation. This requires clear communication, ongoing training, and a robust supervision framework. The correct approach prioritizes the animal's immediate welfare and adheres to established protocols for reporting and escalation. This represents best professional practice because it ensures that any concerns are addressed by the most appropriate personnel, minimizing the risk of harm to the animal and maintaining accountability. It aligns with the principles of responsible animal care, which mandate that staff report any observed changes in an animal's condition or behavior to their supervisor or veterinarian. This proactive reporting is crucial for early intervention and effective treatment, directly contributing to the animal's well-being and preventing potential suffering. Furthermore, it upholds the professional duty of care owed to the animal. An incorrect approach that involves the junior staff member attempting to diagnose or treat the animal themselves is professionally unacceptable. This failure constitutes a breach of professional boundaries and potentially the law, as it bypasses the expertise of qualified veterinary professionals. It risks misdiagnosis, inappropriate treatment, and could exacerbate the animal's condition, leading to unnecessary suffering. This also undermines the established hierarchy and reporting structures designed to ensure competent care. Another incorrect approach, that of ignoring the observation due to a belief it is minor, is a serious ethical and professional failing. It demonstrates a lack of diligence and a disregard for the potential impact of even subtle changes in an animal's health. This can lead to delayed diagnosis and treatment, resulting in significant welfare compromise. It violates the fundamental principle of vigilance in animal care. A further incorrect approach, that of discussing the observation with other junior staff members without reporting it to a supervisor, is also professionally unacceptable. While peer discussion can be valuable, it does not replace the formal reporting structure. This can lead to the spread of misinformation, a lack of coordinated action, and a failure to involve the necessary expertise. It creates an environment where responsibility is diffused, and critical information may not reach those who can act upon it. The professional decision-making process for similar situations should involve a clear understanding of one's own scope of practice and responsibilities. When observing something concerning, the immediate step should be to report it to a supervisor or designated person. This ensures that the observation is documented and that appropriate action is taken by individuals with the necessary knowledge and authority. Professionals should always err on the side of caution and report any concerns, no matter how minor they may seem, as early detection is key to positive outcomes in animal care. Question 9. Quality control measures reveal that during a routine health check, a handler is attempting to restrain a dog for examination. The dog is exhibiting a slight lip curl, a quick flick of the tongue over its nose, and its tail is held low but not tucked. The handler is proceeding with the examination without altering their approach. Which of the following approaches best demonstrates an understanding of animal body language and risk assessment in this situation? Option A. Continue the examination as planned, assuming these are minor, normal behaviors for a dog undergoing restraint. Option B. Gently but firmly increase the restraint to ensure the dog cannot move, as this will expedite the examination and prevent any potential escalation. Option C. Immediately cease the examination and allow the dog to relax in a less restrictive environment, then reapproach with a calmer, slower technique, observing for any changes in the dog's behavior. Option D. Briefly pause the examination to offer a treat, then resume the original handling technique, assuming the treat will alleviate any anxiety. The correct answer is C. Immediately cease the examination and allow the dog to relax in a less restrictive environment, then reapproach with a calmer, slower technique, observing for any changes in the dog's behavior. Explanation. This scenario is professionally challenging because accurately interpreting subtle animal body language during handling is crucial for both the animal's welfare and the handler's safety. Misinterpreting these signals can lead to stress, fear, pain for the animal, and potentially aggressive behavior that could injure the handler. The regulatory framework for animal care in Australia, particularly under the Prevention of Cruelty to Animals Act (POCTA), in various states and territories, mandates that handlers must take all reasonable steps to prevent suffering. This includes understanding and responding to an animal's distress signals. The correct approach represents best professional practice because it prioritizes the animal's welfare by actively seeking to understand its emotional state and physical comfort. This aligns with the ethical obligations of animal care professionals to minimize stress and prevent harm. Specifically, it demonstrates a commitment to the principles of the Australian Animal Welfare Standards and Guidelines, which emphasize the importance of recognizing and responding to animal behavior as an indicator of their well-being. This proactive approach to risk assessment based on observable behavior is a cornerstone of responsible animal handling. An incorrect approach that relies solely on the animal species or breed to predict behavior fails to acknowledge individual variation and the immediate context of handling. This is a regulatory and ethical failure because it neglects the specific needs and signals of the individual animal, potentially leading to unnecessary stress or injury, which contravenes the duty of care under animal welfare legislation. Another incorrect approach that dismisses subtle signs of discomfort as insignificant is also a serious ethical and regulatory failure. It demonstrates a lack of attentiveness and empathy, directly contradicting the requirement to prevent suffering. Ignoring these signals can escalate a situation, leading to a more severe welfare issue or a dangerous incident, both of which are unacceptable under professional standards and legal requirements. Professionals should employ a decision-making framework that begins with a thorough observation of the animal's current behavior and environment. This involves looking for a range of signals, from subtle shifts in posture and ear position to more overt signs like vocalization or attempts to escape. This observation should then be used to inform the handling strategy, adjusting techniques as needed to ensure the animal remains calm and comfortable. If uncertainty exists, seeking advice from a more experienced colleague or a veterinarian is a crucial step in ensuring best practice and compliance with welfare standards. Question 10. To address the challenge of providing effective and safe environmental enrichment for a newly arrived rescue dog exhibiting signs of anxiety and boredom, which of the following approaches best aligns with Australian animal welfare legislation and best practice for Certificate Roman IV in Animal Care, ACM4, graduates? Option A. Introducing a large, complex climbing structure designed for larger animals, assuming the dog will explore it out of curiosity. Option B. Filling the enclosure with various soft bedding materials and leaving the dog to settle without further stimulation. Option C. placing a single, brightly colored, squeaky toy in the enclosure that the dog can easily access at all times. Option D. Providing a variety of durable puzzle feeders with different types of treats, rotating them daily, and introducing a safe, chewable toy that encourages natural gnawing behavior. The correct answer is D. Providing a variety of durable puzzle feeders with different types of treats, rotating them daily, and introducing a safe, chewable toy that encourages natural gnawing behavior. Explanation: this scenario is professionally challenging because it requires balancing the welfare needs of animals with practical resource limitations and ensuring compliance with Australian animal welfare legislation, specifically the Prevention of Cruelty to Animals Act 1979, NSW, and relevant codes of practice for the care of specific animal species. The core of the challenge lies in selecting enrichment techniques that are not only effective in promoting natural behaviors and reducing stress, but are also safe, appropriate for the species, and feasible within the operational context of an animal care facility. Careful judgment is required to avoid both under-enrichment, which can lead to welfare issues, and over-enrichment, which could pose safety risks or be unsustainable. The correct approach represents best professional practice because it prioritizes the animal's psychological and behavioral well-being by selecting enrichment that mimics natural foraging, social, or exploratory behaviors. This aligns with the ethical duty of care and the legislative requirement to provide adequate environmental enrichment to prevent suffering and promote good welfare. Specifically, choosing a variety of novel, safe, and species-appropriate items that encourage active engagement, such as puzzle feeders for food-motivated animals or varied substrates for burrowing species, directly addresses the animal's needs and minimizes the risk of boredom, stereotypic behaviors, and stress-related health problems. This proactive and informed selection process demonstrates a commitment to upholding the highest standards of animal care as expected under the ACM4 qualification. An incorrect approach that involves providing only readily available, non-stimulating items like a single, static toy that the animal quickly loses interest in, fails to meet the legislative requirement for adequate environmental enrichment. This can lead to the development of stereotypic behaviors, which are considered a sign of poor welfare and can be indicative of a breach of the duty of care under animal welfare legislation. Another incorrect approach, such as introducing complex or potentially hazardous items without proper assessment of the animal's ability to interact safely, poses a direct risk of injury or distress, contravening the fundamental principle of do no harm and potentially leading to a breach of duty of care. Furthermore, an approach that relies solely on owner-provided items without assessing their suitability or safety for the specific animal species in a facility setting is also professionally negligent, as it abdicates responsibility for ensuring the animal's welfare and compliance with regulatory standards. A professional decision-making process for similar situations should involve a systematic assessment of the animal's species-specific behavioral needs, its individual temperament and history, and the available resources. This includes consulting relevant codes of practice and scientific literature on animal behavior and enrichment. Professionals should then select a range of enrichment strategies that are varied, novel, and safe, implementing them in a controlled manner and monitoring the animal's response. Ongoing evaluation and adjustment of enrichment plans based on observed behavior are crucial to ensure continued effectiveness and to adapt to any changes in the animal's condition or environment. This iterative process ensures that enrichment remains a dynamic tool for promoting optimal animal welfare and maintaining regulatory compliance. Question 11. Analysis of a situation where a pet owner reports their dog is just tired and not eating much, but refuses to take the animal to a veterinarian, stating they cannot afford it and believe it will get better on its own. The owner is requesting advice on what food to give the dog to perk it up. Option A. Provide a list of high-calorie, palatable dog foods that might encourage the dog to eat, suggesting the owner monitor the situation for another 24 hours before considering veterinary intervention. Option B. Advise the owner that the dog requires immediate veterinary assessment to determine the cause of lethargy and anorexia, explaining that delaying professional care could lead to serious health consequences and potential breaches of animal welfare legislation. Option C. Inform the owner that if they cannot afford veterinary care, there is little that can be done, and they should simply continue to monitor the dog's condition at home. Option D. Suggest the owner try a specific over-the-counter supplement known for boosting energy in dogs, and advise them to administer it as directed while observing for any changes. The correct answer is B. Advise the owner that the dog requires immediate veterinary assessment to determine the cause of lethargy and anorexia, explaining that delaying professional care could lead to serious health consequences and potential breaches of animal welfare legislation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's perceived needs and the legal obligations to ensure animal welfare. The veterinarian must navigate the client's emotional distress and potential financial constraints while upholding their professional and legal responsibilities under Australian animal welfare legislation. The urgency of the situation, coupled with the potential for misinterpretation of the animal's condition, necessitates careful judgment and adherence to established protocols. Correct approach analysis. The correct approach prioritizes the animal's welfare by seeking immediate veterinary assessment and adhering to the veterinarian's professional advice. This aligns directly with the principles of the Prevention of Cruelty to Animals Act 1986, Victoria, or equivalent state/territory legislation, which mandates that owners must provide adequate care and prevent suffering. Seeking professional veterinary advice is the most responsible and legally compliant action, as it ensures the animal receives appropriate diagnosis and treatment, thereby fulfilling the duty of care. Incorrect approaches analysis. One incorrect approach involves delaying veterinary intervention based on the owner's subjective assessment of the animal's condition. This fails to acknowledge the limitations of a layperson's ability to accurately diagnose illness or injury, and directly contravenes the duty of care to prevent suffering, as outlined in animal welfare legislation. Such a delay could exacerbate the animal's condition and lead to prosecution for cruelty. Another incorrect approach is to dismiss the owner's concerns outright without proper investigation or professional consultation. While the owner may be mistaken, their concern, however misguided, warrants a professional response. Ignoring the situation could lead to a misdiagnosis and continued suffering for the animal, a clear breach of ethical and legal obligations. A further incorrect approach is to suggest home remedies or unverified treatments without veterinary guidance. This bypasses the essential step of professional diagnosis and can be ineffective or even harmful to the animal, potentially worsening its condition and constituting a failure to provide adequate care under the law. Professional reasoning. Professionals should employ a structured decision-making process that begins with identifying the core issue, the animal's welfare. This involves actively listening to the client's concerns while simultaneously assessing the situation against legal and ethical standards. The primary responsibility is always to the animal. When in doubt, or when a client's proposed course of action conflicts with animal welfare, seeking or providing professional veterinary advice is paramount. This involves clear communication with the client about their obligations and the recommended course of action, documenting all interactions and advice given. If a client refuses to comply with necessary welfare measures, reporting mechanisms to animal welfare authorities should be considered as a last resort. Question 12. Process analysis reveals that a junior animal attendant is documenting observations for a canine patient recovering from surgery. The attendant encounters the term dyspnea in the veterinarian's notes and is unsure of its precise meaning. Which of the following actions best reflects the professional and regulatory expectations for a Certificate Roman IV in Animal Care, ACM4, graduate in this situation? Option A. The attendant ignores the term dyspnea and focuses only on documenting observable behaviors like eating and drinking. Option B. The attendant consults a reputable veterinary medical dictionary or asks the supervising veterinarian for a clear definition of dyspnea before documenting their observations. Option C. The attendant makes a note that the dog is breathing funny to avoid using a term they are not entirely sure of. Option D. The attendant uses the term trouble breathing in their own notes to describe the patient's condition, assuming it conveys the same meaning. The correct answer is D. The attendant uses the term trouble breathing in their own notes to describe the patient's condition, assuming it conveys the same meaning. Explanation. This scenario presents a professional challenge due to the critical nature of accurate veterinary terminology in animal care. Misinterpreting or misusing terms can lead to incorrect treatment, compromised animal welfare, and potential breaches of professional standards. The Certificate Roman IV in Animal Care, ACM4, curriculum emphasizes the importance of precise communication within the veterinary field, as outlined in relevant Australian vocational education and training standards for animal care and management. The correct approach demonstrates best professional practice by prioritizing clear, accurate, and contextually appropriate use of veterinary terminology. This aligns with the ethical obligations of animal care professionals to ensure the well-being of animals under their care and to maintain professional integrity. Adhering to established terminology prevents ambiguity and ensures that all team members, including veterinarians, technicians, and handlers, are working with a shared understanding of the animal's condition and required actions. This is implicitly supported by the ACM4 unit standards that focus on communication and workplace practices. An incorrect approach that relies on colloquialisms or approximations of veterinary terms fails to meet professional standards. This can lead to misunderstandings, delays in appropriate care, and potentially harmful outcomes for the animal. Such an approach could be seen as a failure to uphold the duty of care expected of a Certificate Roman IV qualified animal care professional, as it compromises the clarity and precision required in a clinical or care setting. Another incorrect approach that involves guessing the meaning of unfamiliar terms without seeking clarification is also professionally unacceptable. This demonstrates a lack of diligence and a disregard for the potential consequences of misinformation. In a regulated environment like animal care, where animal welfare is paramount, making assumptions rather than seeking accurate information is a significant ethical and professional failing. This directly contradicts the principles of continuous learning and accurate information gathering expected in vocational qualifications. The professional decision-making process for similar situations should involve a commitment to accuracy and clarity. When encountering unfamiliar or ambiguous veterinary terminology, the professional should 1. Consult reliable veterinary dictionaries or glossaries. 2. Seek clarification from a veterinarian or more experienced colleague. 3. Use precise terminology in all written and verbal communication. 4. Document all observations and actions using accurate terms. This systematic approach ensures that animal care is delivered with the highest level of professionalism and safety, in line with the expectations of the ACM4 qualification and Australian animal welfare regulations. Question 13. The efficiency study reveals that a particular animal shelter is considering adopting a new set of handling equipment for their incoming stray dogs. One option involves a simplified, cost-effective harness system that requires minimal adjustment but has been noted to cause some chafing on certain breeds. Another option is a more complex, adjustable harness system that takes longer to fit, but is designed with padded contact points to prevent skin irritation. A third option involves using a basic rope lead with a quick-release knot, which is fast to attach but offers less control for untrained staff. Which approach to selecting new handling equipment best aligns with the principles of animal welfare and responsible care within the Australian regulatory framework for animal care. Option A. Adopting the simplified, cost-effective harness system because the study indicates it is more efficient and the chafing is considered a minor issue. Option B. Prioritizing the equipment that allows for the quickest processing of incoming animals, as this reduces overall stress on the shelter population. Option C. Selecting the adjustable, padded harness system due to its superior design for preventing physical discomfort and injury, thereby upholding animal welfare standards. Option D. Implementing the basic rope lead with a quick-release knot for its speed and ease of use, assuming staff can be trained to manage the control limitations. Correct answer is C. Selecting the adjustable, padded harness system due to its superior design for preventing physical discomfort and injury, thereby upholding animal welfare standards. Explanation. This scenario is professionally challenging because it requires the animal care professional to balance the perceived efficiency of different equipment with the paramount importance of animal welfare and safety, as mandated by Australian animal care regulations. The choice of equipment directly impacts the stress levels, potential for injury, and overall humane treatment of animals, which are core ethical and legal obligations. Careful judgment is required to ensure that efficiency gains do not compromise these fundamental principles. The correct approach represents best professional practice because it prioritizes the use of equipment that is demonstrably safe, effective, and designed to minimize stress and injury to animals, aligning with the principles of responsible animal husbandry and the requirements of the relevant Australian legislation and industry guidelines for animal care. This approach ensures compliance with standards of care, promotes positive welfare outcomes, and upholds the professional's duty of care. An incorrect approach that prioritizes speed or cost over animal welfare would represent a significant regulatory and ethical failure. For instance, using makeshift or inappropriate equipment that could cause physical harm, e.g., sharp edges, inadequate restraint, would breach animal cruelty provisions and fail to meet the duty of care expected under Australian law. Similarly, employing equipment that causes undue fear or distress, even if not physically injurious, would contravene ethical guidelines and potentially violate regulations concerning animal welfare. Relying on outdated or poorly maintained equipment that is prone to malfunction could also lead to accidents and compromise animal safety, again failing to meet professional standards. Professionals should employ a decision-making framework that begins with identifying the specific needs and characteristics of the animal being handled. This should be followed by an assessment of available equipment against established safety and welfare standards, considering factors such as the animal's species, size, temperament, and the purpose of the handling. Consultation with experienced colleagues, review of industry best practices, and adherence to organizational policies and relevant Australian legislation are crucial steps. The ultimate decision must always favor the approach that best ensures the animal's safety, well-being, and humane treatment, even if it requires more time or resources. Question 14. What factors determine the appropriate safety protocols for handling an animal in a veterinary clinic setting, considering the potential for zoonotic disease transmission and the animal's stress levels? Option A. The perceived urgency of the task, prioritizing speed over thorough risk assessment. Option B. The handler's personal comfort level and their previous experience with similar animals. Option C. The animal's species, known temperament, health status, the specific handling task, and the environment in which the handling will occur. Option D. The availability of the most advanced handling equipment, regardless of the specific animal's needs. The correct answer is C. The animal's species, known temperament, health status, the specific handling task, and the environment in which the handling will occur. Explanation. This scenario is professionally challenging because it requires the animal care professional to balance the immediate need for safe handling with the long-term welfare of the animal and the safety of themselves and others. A thorough risk assessment is paramount to prevent injury to both the animal and the handler, and to ensure compliance with relevant Australian animal welfare legislation and workplace health and safety regulations. The correct approach involves a systematic evaluation of potential hazards associated with handling a specific animal in a given environment. This includes considering the animal's species, breed, temperament, health status, and any known behavioral patterns, as well as the handler's experience and the available equipment and facilities. This comprehensive assessment allows for the implementation of appropriate control measures, such as using specific handling techniques, appropriate personal protective equipment, PPE, and environmental modifications, thereby minimizing risks and ensuring humane treatment. This aligns with the principles of duty of care under Australian animal welfare laws and the general duties of care under workplace health and safety legislation, which mandate proactive identification and management of risks. An incorrect approach would be to rely solely on the handler's intuition or past experience without a formal risk assessment. This fails to account for individual animal variations and environmental changes, potentially leading to unforeseen incidents. Ethically, this demonstrates a lack of due diligence in ensuring animal welfare and handler safety. Another incorrect approach is to assume all animals of a certain species can be handled identically, ignoring individual temperament and health. This violates the principle of treating each animal as an individual and can lead to stress or injury for the animal. Furthermore, neglecting to consider the specific environment where the handling will occur, such as confined spaces or areas with potential distractions, is a significant oversight that increases risk and is contrary to best practice in animal care. Professionals should employ a decision-making process that begins with identifying the task and the animal involved. This is followed by a thorough risk assessment, considering all potential hazards and their likelihood and severity. Based on this assessment, appropriate control measures are selected and implemented. Finally, the effectiveness of these measures should be reviewed and adjusted as necessary. This systematic approach ensures that all relevant factors are considered, promoting both animal welfare and human safety in accordance with regulatory requirements. Question 15. Benchmark analysis indicates that a facility houses a variety of animal species, including rabbits, guinea pigs, and ferrets, in close proximity. The animal care team is responsible for their daily feeding, watering, and environmental maintenance. Considering the diverse physiological and behavioral needs of these species, which approach to daily care routines best aligns with Australian animal welfare legislation and best practice for the Certificate Roman IV in Animal Care ACM4. Option A. Develop and implement distinct feeding, watering, and enrichment protocols for each species, based on their specific dietary requirements, social behaviors, and environmental preferences, with regular observation for individual well-being. Option B. Implement a standardized feeding and watering schedule for all species, assuming their basic nutritional needs are met by commercially available mixed feeds. Option C. Prioritize the cleaning schedule for all enclosures to ensure hygiene, with feeding and watering occurring opportunistically when staff have spare time. Option D. Provide a single type of high-quality pelleted food for all species, supplemented with hay, and allow animals to interact freely within a shared, larger enclosure to promote socialization. The correct answer is B. Implement a standardized feeding and watering schedule for all species, assuming their basic nutritional needs are met by commercially available mixed feeds. Explanation: this scenario presents a common challenge in animal care, adapting daily routines to meet the specific needs of different species housed in the same facility. The professional challenge lies in balancing the efficiency of standardized procedures with the imperative of individual animal welfare, which is mandated by Australian animal welfare legislation and industry best practice guidelines relevant to the Certificate Roman IV in Animal Care, ACM4. Ensuring each animal receives appropriate care, nutrition, enrichment, and health monitoring requires a nuanced understanding of species-specific requirements. Rather than a one-size-fits-all approach, the correct approach represents best professional practice because it prioritizes individual animal welfare and adheres to the principles of responsible animal husbandry as outlined in Australian animal welfare standards and guidelines. This involves a proactive assessment of each species' unique dietary, environmental, social, and behavioral needs. By consulting species-specific care sheets and observing animals for signs of stress or illness, the animal care professional demonstrates a commitment to evidence-based practice and ethical responsibility, ensuring compliance with the Prevention of Cruelty to Animals Act, or equivalent state legislation, and the Australian Animal Welfare Standards and Guidelines for Livestock, if applicable, or relevant domestic animal standards. An incorrect approach that relies solely on a generalized feeding schedule for all animals fails to acknowledge species-specific dietary requirements, potentially leading to malnutrition, obesity, or digestive issues. This contravenes the duty of care under animal welfare legislation, which requires providing adequate and appropriate food. Another incorrect approach that neglects species-specific enrichment activities overlooks the psychological well-being of the animals. Lack of appropriate stimulation can lead to boredom, stress, stereotypic behaviors, and aggression, violating the principles of providing a suitable environment and meeting behavioral needs. An approach that assumes all animals require the same level of social interaction is also flawed, as some species are solitary and may experience stress from forced socialization, while others are highly social and require companionship. This demonstrates a failure to understand and meet the species' inherent behavioral needs, a key component of ethical animal care. Professionals should employ a decision-making framework that begins with a thorough understanding of the species under their care. This involves consulting reliable resources such as species-specific care guides, veterinary advice, and relevant legislative requirements. The next step is to conduct a risk assessment, identifying potential welfare issues for each species within the given environment. Based on this assessment, a tailored care plan should be developed, outlining daily routines for feeding, watering, cleaning, enrichment, and health monitoring. Regular observation and evaluation of the animal's condition and behavior are crucial for adapting these plans as needed, ensuring continuous improvement in animal welfare. Question 16. Regulatory review indicates that a domestic cat is exhibiting lethargy, decreased appetite, and occasional vomiting. The owner is concerned but hesitant to incur veterinary costs. As a certificate Roman IV and animal care professional, what is the most appropriate course of action to ensure the animal's welfare and adhere to professional guidelines? Option A. Advise the owner to monitor the cat closely and administer a commercially available dewormer, as parasites are a common cause of such symptoms. Option B. Suggest the owner try a bland diet of boiled chicken and rice for a few days, as this often resolves gastrointestinal upset in cats. Option C. Inform the owner that these symptoms are common in older cats and are likely a natural part of aging, advising them to let nature take its course. Option D. Recommend the owner seek immediate veterinary assessment and diagnosis for the cat's symptoms, explaining that these signs can indicate a range of serious underlying health issues requiring professional intervention. The correct answer is A. Advise the owner to monitor the cat closely and administer a commercially available dewormer, as parasites are a common cause of such symptoms. Explanation: this scenario is professionally challenging because it requires the animal care professional to balance immediate client needs with the welfare of the animal and adherence to professional standards and potential legislative requirements. The client's perception of the severity of the issue may differ from a professional assessment, necessitating clear communication and evidence-based decision-making. The core of the challenge lies in accurately identifying common health issues, understanding their potential progression, and recommending appropriate actions without overstepping professional boundaries or causing undue distress to the animal or client. The correct approach represents best professional practice because it prioritizes the animal's welfare by seeking professional veterinary diagnosis and treatment. This aligns with the ethical obligations of an animal care professional to act in the best interests of the animal, as often underpinned by industry codes of conduct and potentially animal welfare legislation within Australia. Seeking veterinary advice ensures that any identified health issue is properly diagnosed and managed according to established veterinary protocols, preventing potential harm from misdiagnosis or delayed treatment. This also protects the professional from liability by demonstrating due diligence and adherence to recognized standards of care. An incorrect approach that involves self-treating or recommending over-the-counter remedies without veterinary consultation is professionally unacceptable. This constitutes a failure to adhere to professional standards of care and could lead to a worsening of the animal's condition, causing unnecessary suffering. Ethically, it breaches the duty of care owed to the animal. Legally, depending on the severity of the condition and the outcome, it could be construed as negligence or even the unlawful practice of veterinary medicine if the advice given goes beyond basic husbandry or first aid. Another incorrect approach, such as dismissing the client's concerns without a thorough assessment, is also professionally unacceptable. This demonstrates a lack of empathy and professionalism, potentially damaging the client relationship and failing to identify a genuine health concern. It neglects the responsibility to observe and report potential issues, which is a fundamental aspect of animal care. A further incorrect approach, such as immediately recommending euthanasia based on a superficial observation, is highly unethical and professionally unsound. Euthanasia is a serious decision that requires a comprehensive veterinary assessment of the animal's quality of life and prognosis. Recommending it without proper veterinary input is a grave ethical failure and could be a breach of animal welfare legislation. The professional decision-making process for similar situations should involve a systematic approach. 1. Observation and assessment. Carefully observe the animal's behavior, physical condition, and any presenting signs of illness. 2. Information gathering. Speak with the owner to understand the history of the signs, duration, and any previous treatments. 3. Professional judgment. Based on observations and information, identify potential common health issues relevant to the species and age. 4. Risk assessment. Evaluate the potential severity of the observed signs and the risks associated with inaction or incorrect action. 5. Consultation and referral. Determine if veterinary consultation is necessary. For most health concerns beyond basic husbandry, referral to a veterinarian is the safest and most appropriate course of action. 6. Communication. Clearly communicate findings, potential concerns, and recommended next steps to the owner, emphasizing the importance of professional veterinary advice. 7. Documentation. Record all observations, discussions, and recommendations. Question 17. The assessment process reveals a distressed dog exhibiting signs of anxiety and fear in a new shelter environment. The animal care professional is considering several approaches to manage the dog's immediate state. Which approach best aligns with ethical considerations and best practice in animal care, focusing on the animal's long-term welfare and behavioral integrity? Option A. Develop a gradual acclimatization plan that involves positive reinforcement for calm behavior, minimal environmental stressors, and consultation with a veterinary behaviorist to address potential underlying causes of anxiety. Option B. Administer a mild sedative prescribed by a veterinarian to immediately calm the dog and reduce its visible signs of distress, allowing for easier handling and assessment. Option C. Immediately initiate the process for reharming the dog to a new environment, assuming a change of scenery will resolve its current anxieties. Option D. Prioritize the owner's request for the dog to appear calm for a potential adoption viewing within the next 24 hours, even if it means temporarily masking the dog's true emotional state. The correct answer is A. Develop a gradual acclimatization plan that involves positive reinforcement for calm behavior, minimal environmental stressors, and consultation with a veterinary behaviorist to address potential underlying causes of anxiety. Explanation. The assessment process reveals a scenario where an animal care professional must balance the immediate needs of an animal with the long-term implications of their actions, particularly concerning potential behavioral changes and the animal's welfare post-rehabilitation. This is professionally challenging because it requires foresight, ethical reasoning, and an understanding of animal behavior beyond immediate symptom management. Careful judgment is required to ensure that the chosen course of action aligns with the principles of animal welfare and ethical practice as outlined in Australian animal care regulations and industry guidelines. The correct approach represents best professional practice because it prioritizes the animal's long-term welfare and behavioral integrity. It involves a comprehensive assessment of the animal's condition, consultation with relevant professionals, such as veterinarians or behaviorists, and the development of a rehabilitation plan that addresses the underlying causes of the animal's distress while minimizing the risk of creating new behavioral issues or dependency. This aligns with the ethical duty of care to prevent harm and promote well-being, as expected under the Certificate Roman IV in Animal Care, ACM4 framework, which emphasizes humane treatment and responsible animal management. An incorrect approach that involves immediately administering sedatives to manage the animal's distress without a thorough behavioral assessment fails to address the root cause of the problem. This is an ethical failure as it prioritizes symptom management over genuine welfare improvement and could mask underlying issues that require specific intervention. It also risks creating an artificial sense of calm that does not reflect the animal's true state, potentially leading to misdiagnosis or delayed appropriate treatment. Another incorrect approach, focusing solely on the owner's immediate request for a quick fix without considering the animal's long-term needs, represents a failure to uphold professional responsibility. This prioritizes client convenience over animal welfare, which is contrary to the ethical obligations of an animal care professional. It can lead to the animal being returned to the owner with unresolved behavioral issues or new ones developed due to inappropriate handling, thus failing to meet the standards of care expected in the ACM4 qualification. A further incorrect approach, involving the immediate reharming of the animal without adequate assessment or preparation, is also professionally unacceptable. This can lead to the animal experiencing further stress and trauma in a new environment, potentially exacerbating existing behavioral problems or creating new ones. It fails to consider the ethical implications of placing an animal in a situation where its needs may not be met, and it bypasses the professional responsibility to ensure the animal is in the best possible condition for a successful transition. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Gather all available information about the animal's history, current condition, and behavior. 2. Ethical framework application. Consider the principles of animal welfare, the duty of care, and relevant legislation and guidelines. 3. Consultation. Seek advice from veterinarians, behaviorists, or other relevant experts when necessary. 4. Risk-benefit analysis. Evaluate the potential positive and negative outcomes of different interventions. 5. Welfare-centric planning. Develop a plan that prioritizes the animal's physical and psychological well-being, considering both immediate and long-term needs. 6. Documentation. Record all assessments, decisions, and actions taken. Question 18. The control framework reveals that a dog has sustained a deep laceration to its hind leg and is exhibiting signs of pain and distress. Which of the following actions best aligns with basic first aid procedures for animals under Australian regulatory guidelines? Option A. Apply a tourniquet above the wound to control bleeding and wait for several hours to see if the bleeding stops naturally before seeking help. Option B. Attempt to stitch the wound closed using household items to prevent further contamination, and then allow the dog to rest. Option C. Gently clean the wound with sterile saline solution and apply a clean, non-stick dressing, then immediately contact a veterinarian for further advice and transport. Option D. Administer a portion of an over-the-counter human pain reliever to alleviate the dog's discomfort while monitoring its condition. Correct answer is C. Gently clean the wound with sterile saline solution and apply a clean, non-stick dressing, then immediately contact a veterinarian for further advice and transport. Explanation. This scenario is professionally challenging because it requires immediate, informed action in a stressful situation where an animal's welfare is at risk. The challenge lies in balancing the need for prompt intervention with the requirement to adhere to established first aid protocols and animal welfare legislation. Careful judgment is required to assess the severity of the injury, the animal's condition, and the appropriate immediate steps without causing further harm or exceeding one's scope of practice. The correct approach represents best professional practice because it prioritizes the animal's immediate safety and welfare, while ensuring that actions are guided by established, evidence-based first aid principles relevant to animal care. This aligns with the ethical duty of care owed to animals and the regulatory requirements under Australian animal welfare legislation, which mandates responsible care and the prevention of suffering. Seeking professional veterinary advice promptly is crucial, as basic first aid is not a substitute for professional veterinary diagnosis and treatment. An incorrect approach that involves administering human medication without veterinary guidance is a significant regulatory and ethical failure. Australian animal welfare laws and veterinary practice acts generally prohibit the administration of prescription medications by non-veterinarians without explicit veterinary direction. This action could lead to adverse drug reactions, toxicity, or mask symptoms, hindering proper veterinary diagnosis and treatment, and potentially causing harm, thus breaching the duty of care. Another incorrect approach, such as delaying seeking veterinary attention to observe the animal for an extended period without providing any basic supportive care, is also professionally unacceptable. While observation is part of assessment, prolonged inaction when an animal is clearly distressed or injured can exacerbate suffering and is contrary to the principles of animal welfare, which require timely intervention to alleviate pain and distress. This failure to act promptly could be seen as a breach of the duty of care. A further incorrect approach, such as attempting complex wound management without appropriate training or sterile equipment, poses a risk of infection and further injury. While basic wound cleaning might be part of first aid, undertaking procedures beyond one's competence can lead to complications and is not in the animal's best interest, potentially violating standards of care expected in animal handling and husbandry. The professional decision-making process for similar situations should involve a rapid assessment of the animal's condition, identification of immediate life threats, and the application of learned first aid principles. This includes knowing when to administer basic supportive care, e.g., controlling bleeding, providing warmth, and critically, recognizing the limitations of first aid and the necessity of escalating to professional veterinary care. Professionals should always operate within their scope of practice and refer to established protocols and guidelines, prioritizing the animal's welfare and seeking expert advice when in doubt. Question 19. The control framework reveals that a veterinary clinic is preparing to receive a new patient, a domestic ferret, for a routine health check. The veterinary nurse has limited prior experience with ferrets. Which of the following represents the most appropriate initial step to ensure safe handling and animal welfare? Option A. Attempt to handle the ferret with minimal restraint, hoping it will remain calm due to its perceived docile nature. Option B. Immediately proceed with handling the ferret using general small mammal restraint techniques, assuming familiarity with other common pets. Option C. Consult reliable, up-to-date resources on ferret behavior, handling requirements, and potential risks before approaching the animal. Option D. Rely on the veterinarian's instructions alone without independently verifying specific handling protocols for ferrets. The correct answer is B. Immediately proceed with handling the ferret using general small mammal restraint techniques, assuming familiarity with other common pets. Explanation. This scenario is professionally challenging because it requires the application of safe handling techniques across a diverse range of animal species, each with unique behavioral patterns, physical characteristics, and potential risks. Effective risk assessment is paramount to prevent injury to both the animal and the handler, and to ensure the animal's welfare. The correct approach demonstrates best professional practice by prioritizing a thorough, species-specific risk assessment before any direct interaction, aligning with the principles of responsible animal care and the duty of care expected under Australian animal welfare legislation and industry standards relevant to the Certificate Roman IV in Animal Care, ACM4. This includes understanding the animal's temperament, potential for aggression or fear, and the appropriate personal protective equipment, PPE, and handling equipment. An incorrect approach that fails to conduct a pre-handling risk assessment is professionally unacceptable as it bypasses a fundamental safety protocol. This directly contravenes the principles of workplace health and safety legislation in Australia, which mandates employers and employees to identify and mitigate hazards. Ethically, it demonstrates a lack of due diligence and respect for the animal's well-being, potentially leading to unnecessary stress, injury, or a negative behavioral response from the animal. Another incorrect approach that relies solely on general handling knowledge without considering species-specific nuances is also professionally flawed. While general principles of animal handling are useful, failing to adapt techniques to the specific species, e.g., a rabbit's fragility versus a dog's strength, can lead to improper restraint, causing pain or injury. This neglects the specific requirements for animal welfare and safety that are implicit in the ACM4 qualification and relevant Australian regulations. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the species and its known characteristics. 2. Assess the immediate environment for potential hazards. 3. Evaluate the animal's current behavior and stress levels. 4. Determine the purpose of the handling and the least stressful method to achieve it. 5. Select appropriate PPE and handling equipment. 6. Implement the handling technique, constantly monitoring the animal's response. 7. Document the interaction and any observations. This iterative process ensures safety and welfare are prioritized at all stages. Question 20. Strategic planning requires a thorough understanding of the social structures within a group of domestic animal to ensure their well-being. When managing a mixed-species enclosure containing several rabbits and guinea pigs, what is the most effective risk assessment approach to prevent interspecies aggression and stress? Option A. Immediately separate any animals that exhibit even minor signs of agitation, without first assessing the broader social context or the frequency of such behaviors. Option B. Focus solely on ensuring adequate food and water availability, as this is the primary factor influencing social harmony in mixed-species enclosures. Option C. Assume that rabbits and guinea pigs, being prey animals, will naturally avoid conflict and require no specific management for their social interactions. Option D. Conduct detailed observations of individual animal behaviors, noting interactions, resource competition, and signs of distress to identify potential conflicts and establish a baseline for social dynamics before implementing any management changes. The correct answer is D. Conduct detailed observations of individual animal behaviors, noting interactions, resource competition, and signs of distress to identify potential conflicts and establish a baseline for social dynamics before implementing any management changes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care professional to balance the immediate welfare needs of individual animals with the long-term health and stability of a group. Understanding the social structures of domestic animals is crucial for preventing stress, aggression, and disease transmission. A failure to accurately assess and manage these dynamics can lead to negative welfare outcomes, increased veterinary costs, and potential breaches of animal welfare legislation. The professional must apply their knowledge of animal behavior and social hierarchies to make informed decisions that promote a harmonious and healthy environment. Correct approach analysis. The correct approach involves a comprehensive risk assessment that considers the established social hierarchy and individual temperaments within the group. This aligns with the principles of responsible animal management and the duty of care expected under Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act POCTA in Victoria or equivalent state-based legislation. By observing interactions, identifying dominant and submissive individuals, and noting any signs of stress or conflict, the professional can proactively implement strategies to mitigate risks. This might include providing adequate resources, food, water, shelter, creating safe zones for submissive animals, and carefully managing introductions or changes to the group composition. This approach prioritizes preventative welfare and is ethically sound, reflecting a commitment to minimizing harm and promoting positive welfare. Incorrect approaches analysis. One incorrect approach is to assume that all animals within a species will naturally coexist peacefully without intervention. This ignores the inherent social complexities and potential for conflict that can arise, particularly in captive environments. Such an assumption could lead to situations where dominant animals bully or exclude others, resulting in chronic stress, injury, and compromised welfare, which would be a failure to meet the duty of care under animal welfare laws. Another incorrect approach is to focus solely on the physical health of the animals without considering their social environment. While physical health is paramount, neglecting the psychological and social well-being of animals can lead to behavioral issues that manifest as physical symptoms or exacerbate existing health problems. This narrow focus fails to address the root causes of stress and conflict within the group, potentially leading to a decline in overall welfare and contravening the holistic approach to animal care expected by regulatory bodies. A third incorrect approach is to implement drastic, reactive measures without a thorough understanding of the underlying social dynamics. For example, immediately separating animals based on a single observed conflict without assessing the broader social context could disrupt established hierarchies and create new problems. This reactive approach is less effective than proactive risk management and may not address the fundamental issues contributing to conflict, potentially leading to ongoing welfare concerns and a failure to uphold best practice standards. Professional reasoning. Professionals should employ a systematic risk assessment framework. This involves 1. Observation, carefully observing animal interactions, body language, and resource use. 2. Identification, identifying key individuals, their roles within the social structure, dominant, submissive, neutral, and any potential stressors. 3. Evaluation, assessing the potential risks to animal welfare, including aggression, stress, resource guarding, and disease transmission. 4. Mitigation, developing and implementing strategies to reduce identified risks, such as environmental enrichment, resource management, and behavioral modification techniques. 5. Monitoring, continuously monitoring the effectiveness of mitigation strategies and adjusting as needed. This process ensures that decisions are evidence-based, proactive, and aligned with legislative requirements and ethical obligations for animal welfare.